Good morning, everyone. The paper presenting is a study on cardiac manifestations of dengue. I am Dr. David, General Medicine PG from KIMS Medical College, and my guide is Dr. MBR Sharma sir. Introduction: Dengue fever is an acute febrile infectious disease caused by any of the four serotypes 1, 2, 3, or 4 of a virus from the genus Flavivirus called dengue virus. The highest incidence of dengue is seen in Southeast Asia, India, and American tropics. Dengue is transmitted by mosquitoes of genus Aedes. Cardiac manifestations in dengue virus infection can range from asymptomatic bradycardia to life-threatening myocarditis. Various studies have quoted several cardiac manifestations of dengue infection: sinus bradycardia, transient AV blocks, transient ventricular arrhythmias, myocarditis, and pericardial effusion. Aim of the study: to study the prevalence of cardiac manifestations of dengue fever in patients presenting to our hospital. The methods and materials: the study design is cross-sectional study and setting. This is a prospective study, was done in Department of General Medicine, KIMS and RF at Amlapuram from December 2019 to December 2020. 100 consecutive patients with positive dengue serology were interviewed and examined. All included patients underwent cardiac assessment in the form of clinical examination, chest X-ray, ECG, and selected patients were also chosen for 2D echo. The inclusion criteria are age group of greater than equal to 19 years, fulfilling the WHO criteria for dengue, and confirmed dengue serology. Exclusion criteria: patients on medications affecting the heart rate or rhythm, patients with history of pre-existing heart disease, patients with electrolyte abnormalities affecting the heart rate or rhythm. The results: this shows the gender, that is which genders are involved and according to the age groups. And severe dengue, we have involved are severe bleeding, fluid accumulation causing the respiratory distress and shock. Of this, fluid accumulation is seen in around 9 patients. And organ impairment, like renal impairment in 6 patients, ARDS and impaired consciousness in 2 patients, and SGOT or SGPT levels greater than 1000 in 5 patients. The cardiac manifestations seen are in ECG changes like 55 people have normal sinus rhythm, 24 have sinus tachycardia, 15 sinus bradycardia, and 11 are having STT changes. 10 people showed T inversions, 3 people showed ventricular arrhythmias, and AV nodal blocks are seen in 2 people. And 2D echo changes are diastolic dysfunction is seen in 3 cases, pericardial effusion in 2 cases, dilated right atrium or right ventricle with elevated RVSP in 2 people, reduced left ventricular ejection fraction in 4 people, and normal study is seen in 13 people. Discussion: cardiac manifestations in dengue virus infection can range from asymptomatic bradycardia to life-threatening myocarditis. Myocardial involvement may be the direct result of dengue virus infection in susceptible individuals or may be due to effects of cytokines or cellular mediators of immune response. The present study was done with the aim of studying the prevalence of cardiac manifestations in dengue. The mean age of our study population was 45 years. 83% of the study population presented to us within the first week of the fever. Of the 100 patients studied, 87 patients were dengue NS1 positive, 9 were positive for IgM dengue, and 4 were positive for IgG. The mean pulse rate of the study population was 70 per minute, and the minimum pulse rate was 40 per minute, and the maximum was 132 per minute. Out of the 100 patients with dengue, 45 patients had cardiac abnormalities. Cardiac abnormalities were seen in 8 out of 13 patients with severe dengue, 30 out of 57 patients with dengue with warning signs, and 7 out of 30 patients with dengue without warning signs. ECG changes were present in 45 cases, of which sinus tachycardia is disproportionate to fever was seen in 24 patients, followed by bradycardia in 15 patients. Non-specific STT changes in 11 patients, T inversions in 10, and ventricular arrhythmias in 3. The commonest rhythm abnormality noted was sinus tachycardia, found in 24%. AV dissociation with sinus node dysfunction was observed in 1 patient, which resolved in 24 hours. Ventricular arrhythmias in the form of ventricular bigeminy, ventricular trigeminy, and ventricular tachycardia was noted in 1 patient each. All these changes reverted back to sinus rhythm in 24 hours in 80% of the patients. Echocardiographic evaluation was done in 18 patients. Abnormal 2D echo findings were present in 5 cases with ejection fraction less than 55% in 4 patients, followed by 2 with pericardial effusion and myocarditis in 1 patient. The conclusion: cardiac manifestations in patients with dengue are not uncommon. But most of the cardiac involvement in patients with dengue are subclinical, with venous tachycardia being the commonest manifestation. It is important to get ECG and 2D echo done in all the patients with dengue fever so that we can prevent mortality from these cardiac manifestations by intervening early. These are my references.